Welcome to Mental Health Matters. I'm Barbara Myers, and I'm the host of the show. On today's show, we're going to focus on situations where mental illness and substance abuse occur in the same person. This is called co-occurring disorders. It has also been known in the past as dual diagnosis. And we're very honored tonight and very pleased to have two commissioners from the Mental Health Services Act Oversight and Accountability Commission who have experience and expertise in the overlap of mental health and substance abuse. I'd like to welcome Linford Gale, who's the Director of the Office of Consumer and Family Affairs in Behavioral Health in San Mateo County. And I'd also like to introduce his service animal, Sophie, who's accompanying him here tonight. Next, I'd like to introduce Dr. David Pading, who is the Chief of Addiction Medicine at Kaiser San Francisco and a specialist in co-occurring disorders. David, I'd like to ask if you could define what co-occurring disorders are and how people have been treated for these kinds of illnesses.
Well, co-occurring disorders occur when an individual has both a mental illness and substance abuse or problems with drugs. About 50% of people that have one condition, a mental illness or substance abuse, also have the other. And the issue around co-occurring disorders is very important to us on the Mental Health Services Commission and to me as a clinician, primarily because there are just so many problems associated with both disorders when they're combined. It's where 2 and 2 don't make 4, they make 10 and sometimes 12. Individuals with mental illness and substance abuse have more problems with drugs and more relapses and more serious consequences, including hospitalizations. They have poor treatment outcomes, and overall their quality of life is not as good as those who have single diagnosis disorders.
You said about half of the people who have mental disorders also have substance abuse.
I always tell my colleagues, when you're dealing with mental illness or substance abuse, it's like my mother used to say when crossing the road, always look both ways, otherwise you're going to get run over. Because, yes, about 50% of people have the other, and if you don't treat it, then they don't do as well.
So how have they been treated in the past? How do you go about treating them?
Well, this is actually the reason that I'm very happy to be here in front of your audience. First of all, treatment is possible, and there is great hope. The conditions can be untangled and taken care of. But what's happened historically in our treatment system is that when you go to a mental health clinic, they say, oh no, you have a substance abuse and a drug problem. You need to go over down the street to the drug clinic. And then you would go down to the drug clinic and they say, oh no, you have a mental disorder. You need to go down the street to our friends down there. And oftentimes people will just end up right in the middle at the liquor store, assuaging their suffering. So it's a condition that we feel needs a lot of attention. And that stigma, which is one of the things that the Mental Health Services Act has been designed to help overcome, has been a very large barrier about why people have not received adequate mental health or substance abuse treatment.
What is the best practice of how to treat co-occurring disorders? Is that, do you just assume that they're both there and you treat them as a sort of a condition in itself, you know, the fact that they're coexistent?
Well, the evidence is that, and certainly my practice experience is that when you have clinics or clinicians or services that can meet the needs of both conditions, people do better. Having them done one at a time, first you get your mental health care for your depression, then you go down and deal with your alcoholism, doesn't quite work as well as doing both. And the issue of integrated treatment is something that we're really trying to emphasize and get the message about.
Could you briefly describe the Mental Health Services Act, just briefly, because both of you are commissioners on the Oversight and Accountability Commission of that?
The Mental Health Services Act was formerly Prop 63, and when it was a proposition, the voters voted that they did want the bill to pass to help people who had mental illness. The commission was a part of the act development, so we have 16 commissioners that our job is the oversight and accountability of the tax dollars collected for the Mental Health Services Act, which currently we have close to $3 billion right now that we've been distributing and working with the counties to ensure that people in each county in California is receiving the mental health services that they need, and making sure that we're doing innovative and different types of services so that it's not business as usual, status quo. You know, this is supposed to be an act that really is going to help transform. We believe in transformation on the Oversight and Accountability Commission, and that's a really, really big deal.
You are a mental health consumer, and you're the chair of the commission. And what is the fact that the commission is being chaired by a consumer say about the transformation of the mental health system?
Well, you know, that is it's an honor. It's an honor, and it's a real big responsibility.
Yeah.
I served as vice chair on the commission under Senator Gerald Steinberg for 2.5 years. And when Senator Steinberg resigned from the commission to go into the Senate and to continue working there, I decided that I would throw my hat in the ring with other people to, you know, see if the commission believed enough in me to vote me in as the chair. And it was a close, very close election, and I think I may have won by maybe 2 votes. And it was really exciting, very stressful, and very, you know, those exuberating moments that you don't know if you're coming or going. But it's really speaking loud to the commission to say that, yes, we do have consumers that can actually handle this big responsibility, and we believe in wellness. We believe people can recover from mental illness, and that spoke very loudly, I think, to the public and to all of the stakeholders involved with the mental health services.
What I'd like to do is now have both you, Linford, and David tell some of the story of how you came to be in this position, and you know, how you persevered even though you may have gone through some trying times. So, Linford?
What happened for me, and unlike many other people with co-occurring disorders, I actually came to San Francisco pretty much in a blackout, and I figured this was as far west as I can go without going into the ocean. So I just wanted to get away from all of the problems I was having back in Ohio, and you know, as they say, you end up with yourself wherever you go, and that's what happened here. And I consider myself a very spiritual person, and hindsight shows me that God actually was involved in all of my recovery and all of my pain that I was suffering during that time, because He brought me to a homeless shelter in San Francisco, and that's where I actually started getting treatment for a mental disorder that I also was self-medicating. So a lot of times, I understand you saying 50% of people with mental illness stop by the liquor store in between those 2 issues. I was doing that for many, many years.
So you were being treated separately?
I was self-medicating, right?
Yeah.
Exactly. I had been hospitalized twice in my life, 5150, as a transitional age youth when I was 17, and it happened again when I was in my early 20s. And from that point on, I just pretty much self-medicated, and my entire 20s is practically a blank. I really don't recall many things that happened in my 20s. And when I ended up in San Francisco homeless, I found a network of people who really attached themselves to me, gave me the support I needed, helped me not feel so ashamed and embarrassed and beating up on myself, where they were actually slowly installing some type of pride and dignity, and I didn't realize that was happening at the time. And the next thing I know, I was taking medications, going to AA meetings, and coming back to the homeless shelter, going out looking for work, and my life actually changed so rapidly, it was really a surprise. And I don't know if it happens like that for every single person, but I believe that I'm not unique, and I think it has happened that way for a lot of people. And I do realize that a lot of people with co-occurring disorders struggle in their recovery, but not everybody. Some people actually do stay sober once they get that insight. And that's what happened to me. I actually had an epiphany. I saw something that was like a spiritual awakening, and I haven't gone back to alcohol or drugs in 17 years. So I feel that although I lost all of my 20s, I didn't lose my 30s, and I didn't lose my 40s. So I'm really appreciative of having someone work with me and help me to...
That's wonderful that you got the help there at that time when you needed it.
It really was a blessing.
Why are you committed to take the role that you have in representing consumers and families at San Mateo and on the commission as well?
You know, I often laugh and joke with my friends and said that, you know, when I was growing up, I didn't say I wanted to be the poster child for mental illness. You know, that was not the thing that I thought I wanted to be, or even thought I even had any issues with it. What happened for me was that I believe spiritually that God put me in situations and places so that the least of us can be looked upon, and He will take some of the least of us and make the most of us with it. And coming from a homeless shelter to being the chair of a $3 billion commission is really speaking highly of what can happen for an individual when they just look up. So a lot of times my faith has carried me through some really, really hard times. Even in my recovery, it hasn't been all rosy. It's been a lot of pain, a lot of going back into therapy and getting on different medications and trying to keep stable and keep myself balanced and still try to work. And there was some shame behind when I would get a job. I didn't want people to know that I was suffering from a mental illness. So there was stigma attached to some of my jobs where I wouldn't admit that. I would say I was a recovering addict. Everybody felt comfortable with that. But I did not feel that they were going to be supportive of me if I said I had a mental illness as well. So what I would do when I would have really a hard time in my recovery from my mental illness, I would take a leave of absence for maybe 4, 5, 6 months at a time until things got a little better. Took a medical leave of absence, and then I would return to work when I was stable and I felt really able to do the job again. So it's ways of doing things to take care of yourself that we can do.
Yeah, and do you still do that, or what do you do to keep yourself mentally?
Well, I haven't taken a leave of absence in almost 10 years,
well,
so that's a good thing.
You must have found another way to keep yourself healthy.
I have moments where it's not as severe as it was. I can see it coming on. There's a thing called Wellness Recovery Action Plan that people have heard about. It's called WRAP.
Yes, we talked about that in one of our previous shows.
Good, wonderful. And when you start getting symptomatic, you can really short circuit it so you don't really go all the way towards that bottom. And I have been practicing that work on myself for years now.
That's great.
Going to the gym, trying to eat properly, trying not to get too stressed out in my life. And actually, Sophia helps me quite a bit with my balancing when I'm in very stressful situations. So, you know, she can come to work with me. I can travel on the airplane with her because, you know, she actually is a part of my wellness and recovery plan. So.
Oh, good. I wanted to talk with you, David. How did you decide to become a doctor specializing in co-occurring disorders?
It was not a direct path. Through my training at 4 county hospitals, I've been in Long Beach and in Martin Luther King and Santa Clara and San Francisco. I really saw a lot of the impact of both mental illness and substance abuse. I mean, you don't have to go far out of any emergency department waiting room to see people really suffering. And there you learn 2 things. You learn always to wear a seatbelt because car accidents are very dangerous, but also those that are plagued with mental illness and substance abuse, just they have overwhelming burdens to overcome. So I left the county system and moved to Kaiser about 16 years ago, and I was there that I was working with a physician surgeon that was running a drug recovery group at Kaiser, and he said, "Please come on in. We need a psychiatrist in our group, and I'd like to see what we do." I didn't know this surgeon was in recovery, and his name was Dr. Lyman B. And at the time, Dr. B would come on in with his big book and say, "I'm Dr. B," put his big book down and say, "I have 13,700 days clean and sober." And
good for him. That's great.
The whole room would just kind of instant respect, instant authority, and I don't think it's every day that your physician tells you he's an addict and alcoholic. And so at that point, I learned this is a disease. It's not just the homeless and the downtrodden and folks that I was working with. This is the disease of everybody. This is lawyers, doctors, teachers, moms, everybody. And particularly in a Kaiser clinic, I couldn't tell who was there for mental health treatment and who was there for just to get their wellness checks. And it really became apparent to me that the ubiquitousness of this. So I began working with Dr. B and very much enjoyed and found that people, when they can get the magic of recovery, which is really magic to a desire to live their lives in a completely different way. Much of what you heard from Linford, Linford is so aspiring on the commission that he really exudes wellness. I think when we're around him, we feel better. But imagine with that, when you're working in an environment where all my clients are in recovery. Every day I get spiritually renewed, and you can really just see the sense of hope and vision. So on one hand, I'm having these experiences where just like this situation looks hopeless. On the other hand, you have this vision of that's what I want, and that's something that I think is worth obtaining. And helping people to shepherd them across this path has just become a really wonderful. It's been a personal mission of mine, and
you can see a lot of passion.
Yeah, I get great joy from it. But that said, the path is not necessarily easy. There's setbacks and there's relapses, and when you have two conditions, mental health and substance abuse, you can use relapse to drugs or you can get depressed again. There are ups and downs, and I guess would want to really share with your audience and with you the message that Linford and I hope to give in different ways is that people really do get better from all of this. I've just seen client after client just.
What keeps you going when you encounter difficult situations? And it sounds like what keeps you going is the fact that you know that people will get better and that you've seen them get better.
Yeah, I think if you look at the negative of substance abuse, you'll be overwhelmed. But I asked this question of a friend of mine that was an oncologist dealing with people with cancer. And he says, there's no negatives. Every day I get to partake of the lives of people that are undergoing wonderful transformations. And it's really that same spirit that I really like to see people making these day-to-day advances. In the Falster tradition, there's a kind of a motto of it's progress, not perfection, or we always say you're sick getting well. So you're never completely there, but it's not as despairing as you would think. And again, I could share stories with you if you would want of people that have overcome that. But it is more true than not.
Yeah. Well, that's good. I'd like to ask Linford, I think you answered this somewhat. What gave you hope when you were, in the worst of it, that you were going to get better?
I took it one day at a time. I really did not know if I was going to stay clean and sober. Was I going to relapse somewhere along the line? I went through treatment, 18th Street Services years ago. And I have a dear friend in the audience who is here supporting me, who actually went through treatment 17 years ago with me as well. And, it's so odd that those 17 years accumulated so quickly to me. Looking back at the struggles and some of the stuff I went through in early recovery and the support system, I've seen a lot of friends relapse. I've had a lot of friends come in and out, and I contribute my sobriety as a gift. It's a gift from God. I realize that it's not really something I did. It's a real gift.
You were open to it.
And I was open to it, and I'm so grateful for it. That's when you hear people say, I'm a grateful recovering addict or alcoholic.
Right.
So when you have co-occurring disorders, you have even more to be grateful for, because you have an opportunity to balance your mental health, but also not try to self-medicate with alcohol and drugs is what I did a majority of my life.
Yeah. Oh, a lot of people do that.
All the way through high school. I mean, like I said before, I was a transitional age youth. They call that a TAY. And I didn't know I was a TAY until I started working in the mental health field. But looking at that, I got 5150 when I was 17 years old is really when I first experienced a mental break, and never really got addressed until in my 30s, which is not unusual. That's quite typical to go through life undiagnosed and really self-medicating and not really realizing how much better life can be if only you were able to, treat some of these symptoms.
What is it that the Proposition 63, the Mental Health Services Act, going to do, or what have you seen it do so far to help co-occurring disorders? I guess I'll ask that to both of you.
Well, David, I think he revived the co-occurring issue for the commission.
Oh, okay.
The commission has really not been that educated. All the commissioners are not like mental health professionals. You have all types of background, businessmen, all these different, it came from 16 different categories. And when David came on the commission, he has this zealous, and the first thing he did was say, can we get this co-occurring committee re-established? Because it kind of had went kind of lame. So it's back up and ticking, and people really wanted to focus only on mental health. Because that substance abuse stuff is tricky. But as Deborah said, 50% of people are suffering with that as well.
It's just half of the people. I mean, that's amazing.
It's half of the people, exactly. And I was one of those half of the people. So it was really, it's really a opportunity to treat the whole person and treat with dignity and respect. So
well, good.
So we're producing a work group report, and the course that Linford again has talked to you about, while it definitely is a miracle, it's not necessarily an accident. We have enough national evidence now that certain scientific best practices can really do very well with treating individuals with co-occurring disorders. We know that certain therapies work. We know certain medications are very useful. We know that self-help programs can be very useful. And on the side of the science, there's lots of evidence of what works. We are finding that clinicians are slow to adopt the practices because it just takes a while to learn and to overcome the many old practices. Stigma has also been one. Even among mental health clinicians that were trained 10 or 15 years ago, we're having to retrain them. And then thirdly is the systems are learning how to talk to each other. Mental health and substance abuse.
Well, thank you. What I'd like to do now is give a challenge to those of you who are in the viewing audience. I want you to think of someone you know who is currently living with a mental health problem and a substance abuse problem. Maybe it's someone you know, maybe it's you. If this person isn't getting adequate treatment, think of how you can help them to get to know the possibilities of recovery that you've heard from Linford and from David. So that's your assignment. Leave it with you. Before we end, I'd like to tell you about some resources and organizations that focus on these issues. There are 12-step programs in every community: Alcoholics Anonymous, Narcotics Anonymous, Al-Anon. National Alliance for the Mentally Ill, NAMI, is an organization that focuses mostly on mental illness, but they also are aware of co-occurring disorders. In the government, U.S. government, the Substance Abuse and Mental Health Service Administration in the U.S. Department of Health and Human Services has a lot of information on its website, which is on your screen. To get referrals in Alameda County, there's an organization called Access, whose telephone number is on your screen that you can call. There are detoxification centers in Alameda County that treat disorders. There are two, one the Sobering Center and another residential treatment center that you can contact. There's a residential treatment place called Bonita House. And if you'd like information about the Mental Health Services Act that we've been discussing here, you can go to the California Department of Mental Health webpage, which is on your screen. And for Alameda County information, there is a special set of web pages that talk about what Alameda County is doing for mental health services. So what I'd like to do is to thank the guests, Linford, thank you, and David, thank you for being here. Very inspiring stories from both of you. And my closing words are from Wayne Arneson. Take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage, for deep down there is another truth. You are not alone. Thank you for watching.